I think if you look at life and you say, I want to be kind to other people, well, what about being kind to yourself? Because it starts there. And one of the tricks is, if you look at your internal dialogue, how do you talk to yourself? If you talk to your friends the way you talk to yourself, you probably wouldn't have any friends.
This is Running for Real, the podcast for runners who know that for every runner's high, there are just as many lows. All those just missed PRs, easy runs that feel hard, injury blues, and more. Each week, we'll talk to running, health, and wellness experts about their highs, lows, and best advice to build our confidence. Running for Real is about being honest, being brave, and most of all, not feeling alone. And now here's our host, Tina Muir.
Hello, my friends. Welcome to episode 139 of the Running for Real podcast. Thank you so much for being here today. I have something exciting to share with you starting this Monday. Now, I love the regular episodes and I feel like I and hopefully you get a lot from them. There's some inspiration, but more importantly, education about either how to be better person, to learn from something that the expert we have on has to share, but also education about something you never knew before, or something about yourself that you didn't consider before. My hope with the entire Running for Real world is that what I give you helps to grow as a person first and a runner second. That being said, there are many topics that I've never addressed or have addressed for a few minutes as part of a long episode, but are things that I really think are very real for many of you listening. Things that make you feel the way I felt when I was trying to keep my amenorrhea or not having a period secret. I felt broken and I felt totally alone in that. And I hate the idea of you feeling about that something that either stops you from running, hinders your running, or even hinders your life. So I wanted to bring these topics out into the light. And if you're working through it, you can hear from an expert or hear from someone who is in the trenches what you can do. And if you aren't working through it, well, you can learn, you can understand how to treat people who are working through it. And I know I can be guilty of this too, and we're going to talk about this a lot in these episodes, that we often worry about putting our foot in our mouth or making the person feel worse. And it feels easier to avoid any conversation with them altogether or just to ignore the point. But that actually makes someone feel really alone and just broken and sometimes invisible. I know you're a good person and I know you would never want someone to feel that way, especially if you imagine a loved one feeling that way. It crushes your heart. So, over the next 8 weeks, every Monday, I'll be tackling one of these topics. These are going to be shorter episodes and there are no sponsors because I just want to help. I want to make people feel better, feel loved, feel seen, and feel appreciated for who they are. All I ask is if you do appreciate these episodes, you consider supporting me on Patreon. Just a few dollars, pounds, lira, yen a month, whatever currency you use, means so much. And it means you get to access bonus interviews and upcoming guests that you can then ask your questions to, because I will let you know ahead of time who I'm interviewing. It may seem trivial and like your $5 a month won't make any difference, but it really does. And I truly appreciate your support. Thank you. You can sign up at patreon.com/runningforreal. That's patreon.com/runningforreal if you want to support me. All right. So episode number 1 is with one of our superstars. Yes, I'm excited to be able to bring together someone from the community who happens to be an expert who can share with us. Ken Johnson is here today, and we are going to be talking about anxiety disorders. We're going to go learn from Ken and we're going to see just how common this actually is. This is a great one to start with because it is something we are all going to interact with if it's not you who is working through this. So let's go meet Ken. Ken, thank you so much for joining me today on the Running for Real podcast. I am really excited you are here and joining me, and this is just really special to have another superstar to talk about a topic that is really important. So thank you for being here today.
Well, thanks for having me, Tina. It's a real pleasure.
Yeah, we've been talking about this for months now, about bringing you on the show, and I wanted to wait till we found the right opportunity, and this just seemed like it was it, doing this series on, some of the topics that are often ignored, often left kind of unsaid. So that is the meaning behind these Running Beyond episodes. And I'd love for you to tell the listeners who maybe don't know you, haven't seen you within Superstars, what it is you do, where you're from, and just kind of a little bit about you so they can get to know you.
Definitely. I'm a psychiatrist and I live in Milwaukee, Wisconsin. I work in a large hospital system, and I'm the chairman of the Department of Psychiatry in a large hospital system. I have 4 children and 3 grandchildren, and I've run recreationally throughout most of my life.
Mm-hmm. I love that. And what was it about running that initially attracted you into it?
Well, Tina, it's interesting. Maybe like a lot of people, I was just pretty good at it when I was a kid.
Okay.
And I really enjoyed doing it. I don't come from a running family. My dad and mom were wonderful people. I don't think they quite understood why I did what I did.
Mm-hmm.
I have memories of running track in high school and my father asking me, why do you warm up like that? You're just going to get tired before you go.
What did you say back?
I said, Dad, that's just what you do. And then I would run out in the country. My mother would worry something was awful was going to happen to me. But I just always enjoyed it. I took up a real shine to it. I frankly wasn't that good at football and baseball and those sports. And I was a long distance swimmer and a runner. That's what I did eventually.
That's great. Well, I'm glad you have kept it up for our sake. And you and I have become friends and email back and forth a lot. And I've been really thankful for your friendship. And for those listening, Ken is one of the most wonderful people, just such a good, genuine person. I'm so happy to have you on here. Now, I wanted to bring you on to talk about, these topics, as I said, are things that are often ignored. But I've been reading the book, Digital Minimalism lately. Have you read that book by any chance? Cal Newport?
I have not. Good. It sounds good.
It's all about kind of basically what our phones are doing to us. And it's interesting and it really makes me think. But in there, the author talked about how a lot, particularly people born 1995 to 2012 are struggling with anxiety. And they think a lot of this research found a lot of the reason they think for that is because they don't have essentially dead time to think, because we're always on our phones, we're always scrolling. Anytime we aren't doing something, even if it's standing in line or if it's walking to the mailbox, we always just instinctively grab our phones. So it doesn't really give us that time to just kind of be with our thoughts and work things through. So they think that's why a lot of teenagers and beyond are struggling with anxiety. But let's talk about anxiety as a whole first. What is it? What would someone recognize it as? And, why is this worth discussing?
Sure. Well, anxiety disorders, Tina, are the most common psychiatric disorders. It's not depression or addiction. Those are up there, but anxiety is actually the most common psychiatric disorder that psychiatrists, psychologists, and therapists take care of. So it's a huge problem. But being anxious is part of the human experience. Anxiety is just something built into the human brain. It's when it becomes an overwhelming fear, persistent agitation that really becomes a problem in someone's life. Then we think of it as a disorder.
Mm-hmm. And so once it reaches that, how does someone know whether they've reached a point where it is now an anxiety disorder, as opposed to, I'm just going through a really stressful period in my life right now, so it's just, I'm just having some anxiety because I'm stressed?
Yeah, I think it's a matter of being honest with yourself and saying to yourself, is this really impairing my ability to be with my family, my work, take pleasure in my life? Mm-hmm. And to really take an honest look at yourself. Or am I doing things that are not healthy to cope with this anxiety that I'm having?
What would be some example? Yeah. You about to say?
Well, am I turning to alcohol and drugs, for example?
Okay.
Or am I turning to inappropriate relationships, sexual misconduct, things like that maybe, good put a Band-Aid on this anxiety, but really don't address the problem.
What about running? Does running fall into that category?
Well, that's a good question. I remember, I think it was your podcast, you had someone on who had an addiction problem, and his friends were saying that he was addicted to running, and he pointed out that he had never lost a job because of running or a spouse. So you could see the tension in that discussion. But I do think there is a line where exercise and running really do go over that line, mm-hmm. and maybe using it just to treat anxiety.
Yeah. Okay. So, if someone thinks, okay, maybe this does go beyond just general anxiety where it is starting to affect my life, what are some things they may recognize within themselves, just on a day-to-day basis? Is it going to be constantly feeling on edge? What are some things that someone should be listening for if they're thinking, maybe this is me?
I think it'd be repeating thoughts of anxiety, these repeating worries that keep coming up, and maybe recognizing you're not attuned to your environment at the moment. Your friends are commenting on it, your family is commenting on it, that you don't seem like you're there because you're always out in your mind thinking of these things.
Okay. Anything else that would be, maybe more physical they might notice?
Like sweating, GI, gastrointestinal problems would be big for most people. Maybe a tremor they would notice. The other thing would be, the inability to, for example, just to go to work and do your job, but constantly ruminating about being afraid of doing your job.
So if someone is afraid, getting to that point where, they can't do their job, they are afraid of their job, of just things happening, like you said, having those reoccurring thoughts, what would be the first step to, what do you do if that sounds familiar to you?
Yeah, I think the first thing you do is you recognize it. And, if you don't have your own practice of maybe learning, if you've not done therapy in the past or your own ways of coping with it, then you probably are going to have to get some help right away for that. Some people have gone through therapy or have other tools, and they may have to go into that toolbox and take a look of what they can do for that.
Mm-hmm. And you mentioned earlier therapists, psychologists, psychiatrists. Who would be the person you would go see for that?
I usually recommend people do one of two things. If they have a friend who's been in therapy, maybe they could ask their friend for the name of that therapist, because perhaps that person is a good fit for them too. Or maybe they go to their family doctor and ask their primary care provider who to go to. The mental health community, at least in the United States, is quite complicated. People don't know, who do you choose? You choose a psychologist, a psychiatrist, a psychotherapist, and then who do you choose amongst those people? It can be complicated.
So what is your answer there if someone said that to you? Or someone is listening and they maybe aren't sure what to do.
I would say probably go to your primary care provider, and hopefully you have someone you like, your family physician or your internist or obstetrician gynecologist. And don't be afraid to tell the doctor that I'm really struggling with anxiety. Tina, I see a lot of healthcare professionals in my practice. I see doctors and nurses and all sorts of people. People have anxiety. And I would be very honest with my doctor and say, this is a big struggle for me, and I would like some help for this. Mm-hmm. And I would first start with, does the doctor know of any therapist that you could be recommended to? I would not start with medication first. I would not do that.
Okay. That's good advice. And I actually, for me, my OB was actually the one. I really liked her as a doctor. She was the one I asked about who I should go see, and she gave me the name of a therapist who I have been working with over the last maybe 6-8 months. And having her recommendation helped a lot, and it immediately made me feel kind of at ease. And on that note, if someone does go to someone and they're not feeling good about it, how long should you give someone, is there maybe a lot of people, maybe if you haven't seen someone before, you might have initial kind of thoughts of this isn't working, or I don't feel any better, or this isn't helping. How long should you give it before you consider moving on or trying or finding someone else?
Sure. Two thoughts. First of all, going to your OB was a really good idea. I'm really fortunate at where I work at Columbia St. Mary's. We have a very large OB department. And I have found out OBGYNs extremely attuned to that in their practices. Mm-hmm. And so that was a really smart idea. And most of them have therapists that they know. And answer to your other question, I think at least 2 to 3 sessions. Often a first session, they want to get to know you a little bit. And so give them at least a few sessions to see if it's a good fit for you.
Okay. All right. That's good.
So, what the data on that, Tina, is the one bit of data. I've been doing this job for 33 years now. And the one data that's never changed, people get better when there's a good fit between the patient and the therapist.
And so the therapist should recognize that maybe they should be able to see themselves that the relationship maybe isn't where it should be after, a certain amount of sessions, and be able to suggest, okay, maybe it's time you speak to someone else.
Or maybe the patient says, this isn't a good fit for me.
Okay.
Because that's what the data will show you, regardless of their training and perhaps the type of therapy they're doing. It's usually the fit between the patient and the therapist.
Okay. All right. And so just diving into anxiety disorders a little bit more, can you tell us a bit, there are some different generalizations, some different types. Maybe tell us a bit about each of those and what someone should recognize within those if that is something they're working through.
Sure. There's many types. In psychiatry, every few years, the disorders get reclassified. But classically, we think of things like generalized anxiety disorder, where people are just anxious almost all of the time. It's a generalized problem, regardless of what's happening in their lives. They're just anxious. Then you think of things like social anxiety disorder, where people can function, but it's very hard for them to get out amongst other people. They hate to be with crowds or even with people they're somewhat familiar with, and then they suffer with that. Classically, post-traumatic stress disorder has been considered a type of anxiety disorder. Often these are people who've gone through trauma, emotional, physical, or sexual traumas. You could also think obsessive compulsive disorder has gone back and forth between being classified by itself or classified as an anxiety disorder. I've always thought of it as an anxiety disorder.
Mm-hmm. And so for someone who doesn't know what that is, what is that?
Obsessive compulsive disorder, it's not like a person, probably most successful people you know are somewhat obsessive. Mm-hmm. And they're always looking at things like a guy like me might say, oh, this call is 5 minutes late. Maybe I'm kind of an obsessive guy that way. Obsessive compulsive disorder is someone who, for example, has to check over and over and over again the door's locked.
Okay.
Or they have to clean things constantly. And they have these compulsive behaviors.
So with that, I don't want to say that it's casually thrown around, but people quite often use the term OCD or obsessive compulsive disorder for anyone who kind of, maybe pays attention to detail or thinks things through or really kind of cares about a particular topic. Do you think we throw that one in particular around a bit too much? Or is, like you said, most successful people are going to be obsessive and very driven? Is there a line that maybe we cross over more often than we should with that one?
I think we do. And I think it's part of the stigma of mental illness. I don't know why we kind of make a joke out of things like that. And, it's become part of the common parlance. Well, he's OCD or that's OCD. It really trivializes a very serious disorder. People with OCD suffer. They'll have these compulsive behaviors or terrible obsessive thoughts. For example, they'll be driving their car down the road and they'll think they hit somebody. And they didn't hit anybody. And they'll obsess over it over and over again. Or they'll have obsessive sexual thoughts. And that's a really difficult illness. If you go to see a surgeon, you hope your surgeon is rather obsessive, right? That he or she is getting in there and doing their procedure. And you don't want him to say, oh, I don't know if I left a sponge in there or not, but no big deal. Let's get going, right?
Yeah.
So all the guys I know guys and gals who do these high-tech procedural kind of work in medicine tend to be obsessive, but they have to be to do what they do.
Mm-hmm. And particularly with this one, if someone does find themselves, like you said, cleaning their hands constantly or repeating something, checking the locks are off, checking their oven is off or whatever it may be, is that something, if someone is working through that right now, that they just say, it's just who I am, it's just part of what I am? Or is that something that, even if it's not overtaking your life, it should be something that you try to speak to someone about and begin to work through so that you can remove that kind of compulsion from what you're doing?
In my clinical experience, OCD often starts in childhood and late adolescence. So I'm an adult psychiatrist, but those of you who have children, mental illnesses often start in childhood. So that sort of thing you can see as a mom or a dad in your child. And you take a look at first, and maybe it's situational, maybe something's going on, or in our own lives, maybe we're stressed out about something and we're feeling a lack of control. So perhaps maybe we try to lock the door more or clean the dishes more, that sort of thing. But really, true obsessive compulsive disorder really is something that probably starts much younger in life and continues on. Yeah.
So it is something, if you do see it in a child, or even if you're dealing with it as an adult, you should try and, work on it as soon as you can with someone, or is it okay to just kind of let it go and just leave it?
I think people suffer with it, Tina. So, most people I know with OCD really do suffer, or they suffer in their relationships. It's hard to be, for example, as a mom, if every time there's a little mess, you're cleaning the little messes up and you obsess about it, and it's really hard to function. Mm-hmm. And obsessive compulsive disorder, of all these disorders we're briefly talking about, it's probably more biological than many of the other disorders.
Okay.
Back in the 1980s, we started to develop medications that helped OCD. Before that, we did mostly psychotherapies, which for pure OCD weren't quite as effective.
Yeah. That is interesting. And what about family and friends who are listening to this today? Maybe someone they recognize is working through any of the anxiety disorders we've mentioned. How can they support? How are they going to hinder things and frustrate the loved ones even more?
I think being critical of people never helps.
Okay.
When you criticize people, they just shut down. And so if you think about life like that, and, yelling or criticizing, my personal experience, it never helps people. But to approach it from a compassionate point of view and to say, I think you're really suffering with this. I've noticed this. Would you like to talk about getting some help, or how could I help with this?
So what if that loved one then says, no, I'm fine. Like it doesn't, I don't, it's okay.
Well, depends on your relationship, don't you think? If you were like the wife, you might be able to ratchet that up a little bit and have a little more leverage in that situation. If you're a casual friend, it may be something that you want to bring up again in a compassionate way in the future, and maybe point out that you're seeing that. Mm-hmm. People are in our culture, people aren't very self-compassionate. No. I think I've emailed you several times about things like that, because people criticize themselves so much.
Mm-hmm. And how can we stop doing that?
Well, that's a great question. I think if you look at life and you say, I want to be kind to other people, but what about being kind to yourself? Because it starts there. And one of the tricks is, if you look at your internal dialogue, how do you talk to yourself? If you talk to your friends the way you talk to yourself, you probably wouldn't have any friends.
That's true.
Many people would say, they do bad, like in a running race, and they'll be on, and I did terrible and all this craziness. And if you talk to one of your friends like that, they're like, I can't stand that woman. I'm not talking to her anymore.
Oh, yeah.
Yeah. Right?
I absolutely agree. I've talked about that a lot, and how you would just be like, that person's a jerk. Like I'm never speaking to them again. They don't care. But okay. So someone who is finding themselves doing that, not giving themselves much compassion, there is a big difference between how they treat their loved ones and how they treat themselves. How do you change that, especially when that's been ingrained in your mind for so many years?
Well, you know what I do? That's a great question. And, the area of self-compassion is a hot area right now in mental health. But what I say to people is, what do you think? Do you perform better if you focus on self-esteem or self-compassion? And what do you think, Tina? What do you think the literature would show?
Compassion.
Yeah. So if you take a group, and studies have been out there, if you take a group of people and you work on self-esteem versus self-compassion, people with self-compassion do better. And an example would be, if you run a race and you do poorly, and you say to yourself, well, I think I did the best I could. I trained, I prepared myself. Wow, I didn't do a very good job, but that's okay. I'm just a human being. You're much more motivated to get up and work at it again. Mm-hmm. If it's self-esteem, you're kind of left with saying, I guess I'm just not very good at this. And most people tend to give up.
Yeah. I remember when I went to see it was either psychologist or I think it was sports psychologist when I was in college. And he at the time said to me, yeah, what would you tell if you had a 17-year-old, I was 17 at the time. Oh, no. Yeah. I must have been a little bit older than that. But he said, what would you tell a 17-year-old daughter? And that completely shifted the way that I thought, because I thought, yeah, you would never run a race or do anything and be like, what a worthless piece of crap you are. Like, how dare you, embarrass me like that? You would never do that to anyone that you cared about. So yeah. And if someone is recognizing this and say, wow, I really do talk to myself that way, but I don't feel like I deserve to be talked to that way. I'm my loved ones are good people. They care about me. They love me, but I don't deserve that. What would you say to them?
I think sometimes that comes from their childhood, Tina. I mean, it's not all about our parents, but sometimes it is. And I think in a respectful way, a therapist can have someone look and say, did you somehow get that message in your childhood in some way? And if not, did you give yourself that message? It really gets into that sense of personhood or self people have as they grow up. And I think with runners and athletes, one of the downfalls could be we get way too tied up in performance. Mm-hmm. And that's how you define yourself. Absolutely.
Well, I've been there and have moved away from there and feel much happier now that mine isn't tied to my performance. And speaking of running, how does running come into working with anxiety disorders? We mentioned earlier, maybe it can be used as a crutch for if you are struggling. You can use running a bit too much as a way to avoid things, especially if you don't give yourself that time to process and maybe are listening to things all the time. But how can running come into this? Can it help if you are working through anxiety?
I think it can help a lot. There's if you take the purely physiology point of it, there's a lot of data out there, the effects of running and exercise on the human brain itself. And I think I sent you a link one time on the effect of sweating on the brain. And this podcast I listened to it's pretty high level physiology, but it's quite interesting. But you got to tie your boots on pretty hard when you listen to that one, because she gets into some pretty deep things. But there's no doubt that exercise does just help your brain and your body. But I think it goes deeper than that, because think of it, Tina, almost every problem you face as an adult is solvable, isn't it?
Yeah.
It may not be an easy solution. It may be an awful situation. As a child, you don't think you can solve things. But as an adult, you can solve the things that come your way. And for all of us, and as I get older, I have to solve some bigger things, or tough things happen to people. But you can deal with those things. And I think running gives you the attitude of, I can do this.
That's true. You know what you've overcome already within your physical body, so you can overcome mental things too.
Yeah, I think that there on the group, there was a guy who, I forgot the details, but he was a bit overweight. He talked about it, but he's taken up running and he's going to do a 5K. And I've been kind of following that a bit and thinking, wow, good for that person. The attitude, I can do this. Yeah.
No, and I think that's a great point to bring up, because that is, from what I've seen when people are struggling with anxiety, a lot of it is, feeling like you have that lack of control over what you can do in your life. And the running is something you can control. You can control the effort you put in. You maybe can't control the outcome, but you can at least have a grasp on something. And we mentioned this a bit earlier. Is there a point where it does become too much? And how can someone recognize if they have to go beyond just using running as a way to deal with anxiety?
Well, I've heard over the years from patients of mine who are dating somebody and the dating doesn't work out. And sometimes the complaint is, my boyfriend or girlfriend runs all the time, or we're going somewhere and she won't go until we run, or we're on this trip and we have to get this run in. And I think a person has to look at that and say, is this interfering with my life with others? Is my boyfriend in general supportive of my exercise, but does he sometimes say something and I just won't shut it down for a day or two? And why won't I do that?
Yeah. And what about speaking out about that? Like you mentioned, with a boyfriend or girlfriend. And, we would hope that most loved ones could either recognize it and see it themselves, or you would have the kind of be brave and tell your loved ones. But what can we do to kind of reduce the stigma around anxiety? What can we do to make this more of an acceptable thing to go see someone for help, to talk about this and say, I have this, I'm working through it and it's difficult, but I'm going to be okay?
I think it starts maybe when they're younger. If you, with your own children, if you're attuned to that and you see them having problems, some of the people in your group are older, like myself, some younger. I don't know if our generation was quite as open to that, but when I hear that your generation talking more, I think parents are more open to that with their children. And I think just recognizing that with their children, they're upset. You could tell they're anxious. Let's talk about it. What's bothering you?
And are there any things you see that kind of make someone more likely to develop an anxiety disorders? Maybe, I mentioned the smartphone, spending more time on your smartphone, watching other people's worlds rather than getting that face-to-face physical connection with someone. Are there any things you see that maybe if someone listening does, they might want to kind of back off that or back off those so that they are reducing their risk of working through this?
I think compare and despair is such a big issue. When you compare yourself to others, there's always someone smarter, prettier, faster, richer. It's just compare and despair. So to maybe get off that smartphone some. I think back when I was a young person, I got home from school. My mom was usually there. I would talk to my mom. And I don't know, I guess I would study and do a few things. But there was no Facebook and talking to people. And you wouldn't see them to the next day. Mm-hmm. And then if I remember having a girlfriend, well, you'd have to call their house. And of course, their parents would always pick up the phone first. So there was that. There wasn't this constantly comparing each other and looking at what's going on.
And what would be your advice if someone does find themselves comparing?
very despairing. I think to look at that and to really own themselves and to say, what's wrong with myself? When I look at who I am, and maybe take a look at the qualities I have in myself. That, you think of your little daughter, how perfect she was when she comes out, and the old saying is, you're perfect just the way you are, and there's always room for improvement. Mm-hmm. And help people take a look at that, and don't compare yourself to these other people.
Mm-hmm. One thing this might be slightly off topic, but one thing I've been kind of learning the more I've been kind of trying to expand my understanding of different situations, different people with different lives, with different perspectives, with different privileges, that the things you judge people on the most are usually the things that you feel most susceptible about. So like things that bother you and you tend to judge people on are things that you tend to be insecure about yourself. Have you found that to be the case with maybe the same with comparison, things that we look at in other people and say, well, they're not doing that right, or they are doing that right, are usually things that's a good sign. Okay, I obviously have an issue going on there. I need to kind of work through that.
I think that's a great point. Maybe, when you look at others and see that probably is a reflection of your own issue that you're having. Mm-hmm. A lot of this, Tina, gets down to learning some capacity of mental discipline, which we don't teach people. And so you've talked a little bit on your podcast about meditation and mindfulness and those things. But if people can get aware of their thoughts when they're happening and they can say, oh, there I go again, I'm judging, you can really work on that and you can learn to let that go a little bit.
Yeah. And it does take time. I will say for anyone listening, I've been thinking about this for a few years now, and I'm only just, I feel, getting to the point where if I see someone who is doing something that I maybe didn't agree with, I before would have to think about it after the moment had passed. Maybe that wasn't a nice thing to think about. But now I'm only just getting to the point where I can say, actually, no, that's not right. Like they're doing the best they can. Like let them be. And it does take time. So thank you for mentioning that, because I think that is something we'll all be working on. And just to finish up here with this, what does the future look like if someone gets some treatment, if someone gets help and does work through this? Is it possible to be cured or to be free from anxiety?
I think it's possible to get help and be cured of a clinically problematic anxiety. We're human beings. We're always going to be anxious about things. Mm-hmm. Okay. It's like a friend of mine who's a very well-balanced guy. When he was going to the airport, he gets all nervous about it. He was doing a meditation one time, and he was telling his meditation teacher about his obsessing about getting to the airport on time. And his meditation teacher said, well, what good did that do you? In a joking way. And it was like a light bulb went off in my friend's head that, we're all going to have anxious situations, but if you address them, I think people can really get a lot of help for that.
Okay. And then
where you go, I'm sorry, where you go in your life, you see that anxiety and it's like a cloud in the sky. You can say to yourself as you get better, there it is. And some of my patients say, there's that repeating cloud. I see it. And sometimes they'll say, well, today I can spend a minute with you, but now you have to go away. They personalize it. And they'll say that they'll call, maybe that's Susie. Susie's always worried about that. Now, Susie, go away for today. And I'm not talking about a multiple personality disorder, but you get my point.
Yeah.
I mean, it's kind of crude. Uh-huh. And they'll say, I don't have time, because that's many people have the repeating anxious things they think about.
Okay. So is there anything else you would like to wrap up with and finish this, just to say to someone who is struggling with anxiety? Like if you were, rather than talking to me right now, if they were right in front of you, I know as a psychiatrist, you can't typically give advice, but if you, as this is, an undefined person, what would be your advice to someone who's listening and is thinking, this sounds all very real to me?
Sure. What I would do is I would like to know what happened in their life, because maybe something happened. And maybe they're anxious. Sometimes, Tina, people will come and they'll be anxious about a relationship, and maybe they sense something's happening, but they don't want to address it. Maybe they sense their husband or boyfriend, girlfriend is losing interest, and there's no need to anxiety, and they maybe have to own that a bit. If not, maybe if it's a generalized anxiety that they're always concerned about, then let's do some therapy. Let's figure out some tools to help you with that. And there'll always be, Tina, there's always going to be more anxious people and less anxious people.
Okay.
For example, there are people who fly jet fighter, pilots. Those guys, ice in their veins, are probably born that way. And there's always going to be people that are just a little more anxious.
Yeah. That makes sense.
Yeah.
And that's true. Okay. All right. So just to get the two final, we'll do two of the running for real questions today. What one piece of advice would you like to give the listeners for life?
I would say to people, be kind to yourself and be kind to other people. We're all in this big soup bowl down here, and why don't we try to be kinder to each other?
I love that. You must be a big Ellen DeGeneres fan. I
am. And listen, compassion, why don't we do that? Why are we mean to each other? What's the point?
I'm trying.
Yeah.
And a running for real moment for you?
I remember a few years ago running with my daughter, and we've had this thing, sometimes I'll beat her and sometimes she'll beat me. Recently, I'm on the losing end of almost every time I run. But about a year ago, I determined I'm going to get her. And near the end of a little 10K race and going up this little hill, and she looked back to me with her pretty blue eyes and took off. At the end, I'm like, wow, how did you do that? And she goes, Dad, I can always run a little faster. And she's 26. I'm like, I don't have that gear anymore. I'm like, okay.
I love that. I think a lot of people will be able to resonate with that, particularly as their children maybe started off as unable to keep with them for even a minute, and now they're long in their dust. So thank you for sharing that, Ken. Thank you so much for your wisdom, for your knowledge, for being a wonderful superstar and friend to me. I appreciate you, and I know the listeners do. So thank you so much.
Thank you so much. I enjoyed this.
My friends, if you have a minute and you could leave a review on your favorite podcast player, Apple Podcasts, aka iTunes, Stitcher, Overcast, Pocket Cast, Spotify, or whatever else podcast player you use to listen to this podcast, or if you would subscribe to this podcast, you will help me get out in front of new runners to make our tribe even bigger and even better. It might not seem like you as one person can make a difference, but really it helps a lot. And it shows me you appreciate the hard work I put in for those. Thank you so much. Thank you so much for listening today. And I hope if you are working through an anxiety disorder, that was helpful for you. And if you're not, I hope you were able to learn a lot and able to be there for someone who is. We all know someone who is. That's just reality. But they may just be hiding it well. So let's all think about the people in our lives. Let's take Ken's advice, try our best to keep those critical comments away. Now, I know how hard that can be, and I have found myself making critical remarks towards my loved ones in the past. Honestly, I didn't feel brave enough to share that on the show, but I did tell Ken that after, and I'm telling you that now. I'm working on it, but I know that it's not easy. At the end of the day, we love these people, so we wouldn't want to make them feel worse, would we? I'll try harder if you will. If you appreciate me in these episodes, I'd really appreciate your support on Patreon. It means so much to me seeing that you've subscribed and are prepared to just pay a small amount each month to support me and kind of help me continue to do this career. You will get bonus interviews and the opportunity to ask upcoming guests your question. You can find out more at patreon.com/runningforreal. That's patreon.com/runningforreal with the number 4. Thank you so much to everyone who has already supported me and is continuing to support me on Patreon. Now, on Friday, we are going to be hearing from Susan Latke, and it is going to be a wonderful episode talking about her book, all about getting outside of your comfort zone, all about trying new things. I mentioned this last week. I love Susan. She's been on the show before, and you are going to love her. So let's go listen to Susan on Friday. If you haven't already subscribed, go do it, and I'll see you then.
Thanks for listening to the Running for Real podcast. Be sure to check out tinamuir.com for show notes and even more helpful running information.